Kamala Harris has managed to take virtually every position on health care policy since announcing her bid for president. Earlier this year, Harris was in line with the progressive wing of the Democratic Party, having signed on to Bernie Sanders' Medicare for All proposal. When asked at a CNN town hall about whether people who like the private plans would be able to keep it, Harris answered clearly, "Let's eliminate all of that," she said of private insurance at a CNN town hall. "Let's move on." But after significant backlash, Harris sought to clarify that she wants to get rid of healthcare bureaucracy. Most recently, she's walked back her support for Medicare for All further in what is seemingly an attempt to satisfy both the more moderate and more progressive wings of the Democratic Party. Twisting truth and trying even Democrats' patience, Harris has rolled out her own health plan, keeping the Medicare for All moniker but introducing elements completely at odds with the Sanders proposal. Specifically, Harris would keep some private insurance while simultaneously expanding coverage for the nation's unaffordable Medicare program beyond its ability to bear such a burden. Coverage would apply to all medically necessary services, including emergency room visits, doctor visits, vision, dental, hearing aids, mental health and substance use disorder treatment and comprehensive reproductive health care services. As if that weren't enough, Harris also promises additional benefits in the future. Voters don't like this kind of shell game, and with good reason. Their whiplash over the past 10 years has left them sour on more meddling. They saw President Obama shifting from the public option to the individual mandate, defending Obamacare as national Romney care, watching the rollout, failing to keep state exchanges viable, winning a squeaker United States Supreme Court case, and finally leaving the mess to, today, a Democratic field where no candidate wishes to leave Obamacare unchanged. That puts candidates like Harris in a tough spot, trying to appease the woke base agitating for nationalized health care without turning off traditional Democrats who like big entitlements but reject big changes. So just as Harris has had to pivot to Iowa for fear of being knocked out early, Iowans have thrown cold water on her misbegotten effort to square the health care circle. One new poll shows more than half of caucusgoers in her party want private coverage plus a public option, while barely 1 in 5 want to switch everything out for universal Medicare. And a video capturing a nursing home resident railing against Harris and her scheme has gone viral on social media. Harris finds herself in an unenviable position. Perhaps given the divides on the left today it's unavoidable. But that doesn't make her health care plan anything other than dead on arrival. As Peter Suderman at Reason put it, rather than honestly reckon with the contradictions of her previous statements and the trade-offs inherent in any health policy proposal, Harris has merely attempted to paper over those contradictions with yet another poorly thought-out, detail-light plan designed to allow her to make promises she cannot possibly keep. Let's block ads. Why?